Welcome to Crash Cart Nursing, where we help resuscitate your nursing education one topic at a time. I'm Nick McAllister. I'm a registered nurse specializing in emergency medicine and a professor of nursing. Today we're diving into psychobiological disorders, conditions where mental health meets biology. These disorders remind us how closely intertwined the mind and body truly are. Let's explore what makes them so unique and how we as nurses can provide the best quality care. Psychobiological disorders sit at the intersection of psychological and biological factors. This includes anxiety, depressive, bipolar, psychotic, personality, and trauma-related disorders. For each of these, understanding the underlying biology is crucial to better supporting our patients. Think of it like this. If the brain is the hardware, mental health issues are often software glitches. In psychobiologic disorders, though, the hardware, the brain, and its chemistry may also need repair. Imagine a patient with a major depressive disorder. It's not just sadness. It's a full body experience, often linked to imbalances in neurotransmitters like serotonin, dopamine. Understanding this helps us guide patients toward therapies that restore balance to whatever area is off, whether that's medication, counseling, or a combination. An easy way to remember neurotransmitter involvement is DSN, dopamine, serotonin, norepinephrine. Depression primarily involves low levels of serotonin and norepinephrine, while schizophrenia is linked to excessive dopamine. Think sadness needs serotonin, mania drives dopamine. Let's start with anxiety and trauma-related disorders. Generalized anxiety disorder, panic attacks, and PTSD are all common conditions you'll encounter in nursing. These patients often have heightened responses to stress due to overactive pathways in the brain, particularly in the amygdala and hypothalamus. And a good example of this is picturing a veteran experiencing PTSD triggered by loud noises. Their response isn't just emotional, it's physiological. Their heart races, adrenaline spikes, and they feel as though they're reliving the trauma. Your role is to help them feel safe and provide tools to regulate these reactions, like grounding techniques or guided breathing exercises. Research has shown that trauma physically alters the brain. Prolonged exposure to stress hormones like cortisol can shrink the hippocampus, the region responsible for memory and emotional regulation. This is why therapy and structured interventions such as eye movement desensitization and reprocessing, or EMDR, can help reprocess traumatic experiences and reduce symptom severity. If you've never tried EMDR, it is actually pretty amazing. I went through it a while back after my dad had passed away. I was having some severe anxiety, panic attacks because it was a sudden loss when my dad passed away. And for the first time in my life, I felt true panic set in. I was worried about the safety of my wife and my kids. I remember one time it was so overwhelming, I felt like I needed to leave work, and I was in the middle of caring for patients. This was prior to me obtaining my nursing license. I was still working as a certified nurse aide, and I just had this like overwhelming feeling that like my family was gone and I wanted to leave work. I was ready to abandon my patients. Like it was just absolutely ridiculous. I was having a full-on meltdown, not only emotionally, but also in my physical body. I felt stress rising up into my chest. I was, developing chest tightness. I was short of breath. I was just completely an anxious mess. And I felt like there was nothing that I could do to take care of it. So I ended up going and seeing a counselor about it. She started me on EMDR the second week. And I had these little devices that she put in my hand that would vibrate in one hand and vibrate to the other. And it would kind of pass back and forth. And then she systematically guided me back to those events that I felt like were causing the triggering moment. What this does is causing a rapid eye movement type of state like you would go into when you're sleeping, allowing you to reprocess those memories, those things that maybe you forgot about. And there were details for me that I forgot about. And when she went into that, oh my gosh, it was so crazy to help me get through it. to where the panic attacks came to a substantially less volume that they were happening, and I was able to return back to my normal life. So it's a really great tool. I encourage you, if you go through that, to use it. Find a counselor who does it. Find a mental health professional who does it, because it can be so helpful in reprocessing traumatic experiences and can help reduce symptom severity, like seriously. So the memory tool for this is to differentiate PTSD from generalized anxiety disorder. Remember, PTSD equals past. Trauma from the past events cause present symptoms, while GAD is global. So anxiety is about general, ongoing worries about the future, etc. So PTSD focuses on the past. Generalized anxiety focuses in on a more global issue, just things happening in general. Next, let's talk about depressive and bipolar disorders. These are often linked to imbalances in neurotransmitters like serotonin, epinephrine, and dopamine. Depressive disorders may leave patients feeling hopeless, while bipolar disorders add the complexity of mood swings ranging from debilitating lows to euphoric highs. A patient describing depression might say, "I feel like I'm stuck in a fog," while a manic episode might feel like being invincible but out of control. As a nurse, you'll monitor medication adherence, educate patients on recognizing triggers, and help them maintain balance through structured routines. Remember, bipolar is equal to a battery. It has a positive manic and a negative depressive charge. Mania is the high energy phase, and depression is the drained battery. So that's a good memory tool to help you remember bipolar disorder. Psychotic disorders like schizophrenia involve a break from reality. Hallucinations, delusions, and disorganized thinking are hallmark symptoms. Understanding these symptoms help us tailor our approach to care. Let's bust a myth. Schizophrenia isn't just about hearing voices, it's also about cognitive difficulties, trouble focusing, or processing information. This can make everyday tasks overwhelming for patients. Imagine a patient who believes the TV is sending them messages. Instead of arguing, you might use grounding techniques like asking, "What's something you can see or hear around us right now?" This approach validates their experience while gently redirecting them. Personality disorders like borderline or antisocial personality disorder often stem from a mix of genetic, environmental, and social factors. These patients may challenge your patients, but remember, they're navigating deep-seated patterns of behavior and thought. A key tip is to maintain boundaries. For example, a patient with borderline personality disorder might test limits to assess trust. Your role is to remain consistent and compassionate while keeping the therapeutic relationship professional. To remember the 3 clusters of personality disorders, think of the phrase weird, wild, and worried. Cluster A, weird. So these are autocentric personality disorders. This includes paranoid, schizoid, schizotypal, and personality disorders. Cluster B is the wild ones. These are dramatic, emotional, or erratic. And these include borderline, antisocial, narcissistic, and histrionic personality disorders. While cluster C is the worried, anxious, or fearful. This includes avoidant, dependent, and obsessive compulsive personality disorders. Neurocognitive disorders such as Alzheimer's disease result from brain deterioration and can severely impact daily life. Unlike other psychobiological disorders, neurocognitive conditions are progressive, meaning they worsen over time and require evolving care strategies. Alzheimer's disease is the most common neurocognitive disorder. It's characterized by memory loss, confusion, personality changes, and difficulties with daily tasks. It results from the buildup of beta amyloid plaques and tau tangles in the brain, leading to neuron death and cognitive decline. This is not a normal aspect of aging, and oftentimes when we're working in long-term care, we assume that a normal part of aging is deterioration of the brain. It is not. Imagine a patient in the early stages of Alzheimer's who starts forgetting recent conversations, but they can recall childhood memories with perfect clarity. This is because Alzheimer's affects short-term memory first before advancing to long-term memory loss and full cognitive decline. A good memory tool is using the acronym OLD ACORN for Alzheimer's progression. It stands for orientation lost first, language difficulties, decision-making impaired, activities of daily living affected, confusion increases over time, other family members affected, routine loss causes distress, new memories go first. Care strategies include structured routine, simple communication techniques, and safety modifications in the home environment to reduce fall risk. Nurses should also be aware of the impact on caregivers, as Alzheimer's care is demanding and emotionally taxing. In later stages, patients may experience wandering, agitation, or even aggression due to confusion. Understanding their frustration can help nurses provide compassionate, patient-centered care. Techniques like reminiscence therapy, where patients discuss past experiences, can provide comfort and a sense of familiarity. We covered everything from anxiety and bipolar disorder to neurocognitive disorders like Alzheimer's. As nurses, understanding these conditions allows us to provide holistic care and advocate for our patients' unique needs. All right, nurses, that wraps up this episode of Crash Cart Nursing. I'm so glad you came. I hope you found today's discussion helpful as you continue your journey in nursing. Remember, every shift is a chance to learn, grow, and make a difference. So stay curious, stay confident, and most importantly, stay compassionate. If you enjoyed this episode, don't forget to subscribe so you never miss a new one. And if you found this helpful, share it with a classmate or a coworker. Let's build this community together. Have a question, a topic request, or just want to share a nursing story? Reach out on any platform you like best. Links are in the bio. I'd love to hear from you. Until next time, keep your crash cart stocked, your caffeine intake high, and your assessments thorough. See you in the next episode.